My name's Sari and I'm a speech and language therapist working with Glossa Speech Therapy. Were you aware that over 30% of patients with disorder of consciousness may be misdiagnosed? For clinicians working in rehabilitation, that statistic highlights just how important accurate assessment really is. This is the first episode in a short series exploring prolonged disorder of consciousness, or PDOC, and recommended assessment of this disorder. These conditions sit at the complex intersection of neurology, rehabilitation, and ethics, and understanding them is essential for clinicians involved in the care of people with severe brain injury. So what is prolonged disorder of consciousness? PDOC refers to a state of severely altered awareness that persists following a significant brain injury. It occurs when there is widespread disruption to the brain networks responsible for consciousness. And common causes can include traumatic brain injury, such as a road traffic collision or a fall, a hypoxic brain injury where the brain is deprived of oxygen, stroke, particularly large or brainstem strokes, and occasionally infection or inflammatory conditions such as encephalitis. And the cause really does matter because individuals with traumatic brain injuries often have a greater recovery potential than those with hypoxic injury. So understanding consciousness helps to understand prolonged disorder of consciousness. So consciousness has two key components, wakefulness and awareness. Wakefulness refers to the ability to open the eyes and demonstrate a sleep-wake cycle. Awareness refers to the ability to experience and interact with the environment that you're in. In PDOC, wakefulness may be present, but awareness is absent or significantly reduced. PDOC is an umbrella term that includes different clinical states. A person may be diagnosed as being in a vegetative state, and these individuals may be observed opening their eyes and demonstrating a sleep-wake cycle, but there is no evidence of awareness of themselves or their environment. The responses that are observed to stimulus are reflexive rather than purposeful. In a minimally conscious state, there are clear but inconsistent signs of awareness, so you may observe visual tracking, emotional responses, and occasionally following simple commands. However, it's the inconsistency of these responses that fall into the minimally conscious state. Accurate assessment is crucial. Without careful, repeated, and standardized evaluation, signs of awareness are easily missed. And this can affect the rehabilitation opportunities and influence important decisions about that person's care. This is why structured tools such as the SMART assessment play such an important role in specialist neurorehabilitation. In the next episode, I'll explore how structured assessments help clinicians identify the signs of emerging awareness. If you work in rehabilitation medicine, therapy, case management, and you're interested in learning more about PDOC assessment and rehabilitation, please feel free to contact us. Thank you for watching.